Hello, it's Easter Monday, March 28th. I'm David Common, in for Matt Galloway, and this is the Metro Morning Podcast. So imagine this. You have a stroke 20 years ago. That is the story for Howard Rocket. And then 2 decades passes, and he's suddenly able to use his left arm, something that effectively had not worked. The reason why is a new neurorehabilitation therapy developed right here in the GTA. It's called MyndMove. It's not covered by OHIP. Some private insurance companies will cover it in certain circumstances. Through it all, Howard was recently able to move his fingers, and he came into studio this morning along with Deanna Pliura. She is the CEO of MindTech, and she works closely with many of the company's patients, including Howard.
I actually had the stroke. I lost pretty well all function. I couldn't speak, I couldn't see, I couldn't move, and my entire left side was totally paralyzed.
You're not an old man now. This happened
Thank you.
Yeah.
No, well, this was a football accident, basically a head injury, which resulted in a stroke, but it's the same thing.
Okay. And if at that point, what was the expectation for some degree of recovery of your abilities?
At that point, I was told within 6 weeks, if some of the muscles don't recover and come back, they're never going to recover. But that's not entirely the truth.
Okay. What did you try then in the intervening years to try to get things back, and did anything work?
Well, I was lucky that some of my function in my leg did come back so I can walk. But in my arm was totally 100% paralyzed.
Your left arm
totally gone.
Gone, completely gone. And now?
Well, I was approached by the CEO of the Toronto Rehab Center, Cindy Yell, to try this therapy, this new therapy, MyndMove therapy, that was developed at the Toronto Rehab and has been commercialized by Deanna and her company. And I said, well, I've tried electronic stimulation before, and it didn't really work. So she said, well, this is different. It's functional. And it was different. And the difference between that and anything else I ever tried is this worked. And my hand...
What's that like?
Well...
I mean, it's been so long, all things considered.
Well, normally when I get nervous, I'll laugh instead of crying. And when I saw my hand move for the first time in 20 years, because I never expected it to ever move again, I got very emotional, but I started to giggle, which is the reaction that a stroke patient would have. So it was very overwhelming.
Okay, so Deanna, let's go over to you. What is this therapy? How does it work?
So it is as Howard said, it's a non-invasive functional electrical stimulator. So we give small pulses of electrical stimulation to the muscles so to get them to contract. But the really important part of this is that Dr. Milos Popovich, who is the chair in spinal cord injury research and the inventor, he's our rock star scientist, he developed these series of algorithms that are very sophisticated that allow us to get a very natural movement. So if someone wants to reach forward and grasp something and bring it back, we can mimic that. So the therapy requires the patient to have the intent to do a movement. A trained therapist works very closely, watches carefully, and when the command signal is being given out, she then activates the activation of those. So eventually what happens is we essentially rewire the central nervous system so that the muscles in the arm and the intent in the brain couple together and you get voluntary movement back again.
Your mind relearns, essentially. Yeah. Isn't that something? And how is it that this electrical stimulation therapy works for Howard when he says previous electrical stimulation didn't work?
I think it's the level of sophistication and the approach that we've taken. A lot of the other stimulators were quite simple in terms of both the number of electrodes they might do or the types of pulses that they might give. What we provide is the appropriate signals that provide a functional movement. And we couple it with a trained therapist who actively engages with the patient at all times to make sure that we get the right outcomes for these individuals.
Howard, how do you compare your life now to the life you had prior to getting this ability back?
I could do about 4 or 5 really functional things, like putting on a glove with 5 fingers. My hand used to be totally clenched, and now it's relaxed. I can take cards out of my card wallet without using my teeth. So, and there's 3 or 4 other things that I can do, including actually picking up a can with a straw and drinking from it with my left hand.
How big a deal is that? I mean, if I just
That's
pick one thing.
It's a huge deal. I can't tell you how incredible it was the first time I did it. It's like having 100 birthdays in one time.
Now, this is still experimental?
No. MyndMove is actually approved by Health Canada.
Yeah.
So it's a registered medical device here in Canada.
But it's not covered by OHIP.
Yeah. So medical technologies sort of have a 2-step hurdle component. One is to get through the regulatory approval for safety and through Health Canada. The other is to get the reimbursement. We're actively working with Mars Excite here in the Toronto region and with our Ministry of Health to collect the data that will help to inform policies so that the governments will be able to make the decision to allow every patient who deserves to have the opportunity to regain the use of their arm, that opportunity to do so, whether they have had a stroke, traumatic brain injury, or spinal cord injury.
This is a therapy and not a drug, but sometimes you hear about drugs that aren't covered by provincial healthcare plans in part because they're astronomically expensive. Is this something, because you're at an early stage, that's still a rather expensive thing to do, or is it...
Our price point is actually very competitive.
Yeah.
If you look
relative
to what is currently being offered, relative to competitive technologies that actually do not provide voluntary movements. So sometimes there are products that people will wear as an orthotic.
Yeah.
So an orthotic is a permanent kind of wearable that you would do. It doesn't actually restore voluntary movement. It may be limited to maybe one part of your arm as opposed to the entire arm, which is what we can do. So if we look at the price point there, I think the most important part, though, is when individuals, and we have many clients now who can do activities of daily living again. They can dress themselves better. They walk faster. They can prepare meals. We have spinal cord injury individuals who can now use their hands to make a sandwich and feed themselves, they practice picking up marbles, and with that they can now pick up food and popcorn and peas off of the plate. It's quite a liberating thing, obviously. It restores dignity, and it saves money because people no longer need a personal care support worker to help them with some of these very basic things that you and I did this morning without thinking.
That is Howard Rocket and Deanna Pliura. She is the CEO of MyndTech. He had a stroke 20 years ago, and through this therapy has been able to regain the use of his left arm.